She's 74, disabled and with a catalogue of illnesses. But Miriam has given up on trying to see her GP.
If you're ill, you need to see somebody within that day, not tomorrow, next week. You know, it's the whole of the National Health Service. It's all of it. It's gone.
It was remote consultations that helped GPs see patients through the pandemic. But that system doesn't work for people like her.
They're just so busy, aren't they? They just can't come out. They've got too many patients. The hospitals give up on me, so the GPs must have give up on me. I just feel as if they're waiting for me to die.
With a brutal winter ahead, a form of help is on the way. A support package from government, which they say will alleviate pressures.
1/3 face-to-face, and sometimes more, and the rest are telephone.
But with it, surgeries will now be ranked in new league tables that name and shame those failing to offer enough patient access.
Today's package is all about support. It's about having more appointments and having more prompt appointments and allowing patients to have more choice in the way that they're seen.
In Liverpool, the country's leading GPs kicked off their annual conference. But instead of feeling supported, today they feel targeted.
The malicious criticism of the profession by certain sections of the media and by some politicians as a result of the shift towards remote working, introduced to keep our patients and our teams safe and keep the service operating, has been the worst that I can remember in over 30 years as a GP.
Even before the pandemic, GPs were pleading for help. With some of that now on the way, government expects more face-to-face contact with patients in return. But this all falls on the backdrop of a creaking health service, which faced its busiest September on record. GPs are and will always remain the first line of care for anyone.
That's all right, take your time.
But with a damaged system and a burnt-out workforce, they feel the money is simply not enough.
Obviously, we are short-staffed like every other GP surgery in the country. That means that we have to work around the clock, really, sometimes. We work until midnight. £250 million, what is it going to solve first? Is it going to solve the appointments problem? Is it going to solve the health inequalities problem?
To many working in primary care, this will feel like yet another plaster stuck on a deepening wound. And it's patients who'll suffer as the pressure mounts. Inzamam Rashid, Sky News, Liverpool.